pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Here. Commissioner Brooks will be a little bit late. Commissioner Lupici will not be here today, and Commissioner Purdy is not going to be here today. I'm going to call for changes to the agenda. If there is any changes. And I will ask for a vote to approve the agenda as presented.
Chair, I move to approve the agenda as presented.
Second. It's been moved and seconded to approve the agenda as presented. Is there any discussion? Hearing none, all those in favor? Aye. Is there by chance any public comment?
There is not, and there was none submitted.
Introduction of new employees.
Thank you, Chairman. I would like to introduce Nikki Giosa, one of our newest dietitians for our WIC program.
And my background, so I'm Nikki, and my background is Peds GI, home care, and formula sales. So kind of the whole circle of dietetics.
What was the first one?
Pediatric GI.
Thank you. Thank you. Welcome. Commissioner Brooks has word. Everyone had a chance to go through the minutes. For motion to approve the minutes, unless there's any changes, that's presented.
Will we approve the minutes as presented?
Been moved and seconded to approve the minutes as presented of October 2025. All those in favor? Aye. Okay, we'll move right along. Next on the agenda is the September 2025 monthly expenditure and revenue report. Chelsea.
Yes, thank you, Mr. Chairman. First, I wanted to start with at the last meeting, Commissioner Reeve asked about the higher percentage in the administrative expenditures compared to where we were in the fiscal year. And I think we addressed that with her directly, but so that everybody gets that answer, we have the infrastructure sub-grant in the administrative area of our fiscal structure, our GL accounts. So a lot of that higher expenditures are due to those expenditures not being spent evenly throughout the year. Like one piece of the infrastructure sub-grant is completely spent out for the year, although it does go through June. So there aren't any more funds left in it to spend. So it kind of skews the percentage that you see there. So. Okay, so the September report here is all of our revenues and expenditures processed through the accounting system through September. That's the target is 25% of the fiscal year so far, 3 out of the 12 months. At the top left, you'll see the fund balances. Our cash balance is the first line there, and then the 3 lines under it are the investment accounts with a total of the 8,600,000 number you see there. And over to the right-hand side are the year-to-date and the month-to-date for September, as of September 30th. Revenue and expenditures, that's a high-level summary that you're looking at. And you see that the revenue and expenditures are about equal each other out. They're just about that $100,000 difference between the two numbers, so. um, We're spending about what our revenue's bringing in each month so far. And as we go down the page there, that's the list of all of the programs that we've detailed out, the revenue that each of them receives, and their month and year-to-date totals. Some of them are a little bit more than that 25% target, some of them are less. But overall, we're sitting at 25.41% of the revenue collected that we've expected at this time of the year.
It's the Millennium Tobacco, is that because they sent in a couple of payments rather than just?
Yeah, they sent in
One.
one payment at the beginning of the year.
Okay,
Yep.
so the 76 minus the 25%.
Yeah, so that's why it'll show a higher percentage there.
And then the partnership success. That is 50%, 57%.
Yes, and we have two federal grants, and that's one of them, direct federal grants. And we were kind of behind on drawing the funds. So that's why there's a larger percentage there as well.
Is there a reason that we were behind drawing the funds?
Yes, the turnover in the finance area last year, and there's a lot of red tape, I guess you would say, to get into all the different systems to draw those funds down. Yeah. So with people coming and going and not being here long, there wasn't enough time to actually get the access to draw the
One more
funds.
question, the other ECHS, what is that one?
Yes, the ECHS, and I probably want to split some of these out at some point when they get to be a significant amount, but 302,000 of that year-to-date total, excuse me, is an opioid settlement payment.
Okay. That answers the question. Thank you.
You're welcome.
Mr. Chairman, I have a question, and maybe you addressed this on the fund balances, and I didn't hear it because I was too busy crunching numbers. The fiscal year beginning column total, I get a different number when I add that one up.
We go down.
The 8.983.
Fund balance.
I do
Fund
too.
balance, the very top left.
I do too. Oh, look at that. I get a different number as well. Do you get 8.4 million?
Yes.
Okay. Yeah, I'm not, I'll look into that and I'll get back to you probably before the end of the meeting. I'm looking at the previous months here. They all have that same number. It's July. We'll get you an updated number here.
Thank you.
Yes. Is there any other questions on the revenue? Page here? Okay, we can move to the expenditures on page 2. Again, these are all the various programs and their personnel operating TMB that's been paid since the end of September, year-to-date totals. And again, there's some that are more than the 25% of the year and some that are less. But overall, we're just slightly under that target number for this time of year.
Any questions? Thank you. Joe.
You're welcome.
Now we'll move on to the second one of yours.
The second one is just an FYI for you guys. We are just changing kind of the process of how we pay you out of our Luma system, our accounting system. And so we're setting you up as vendors, but Katrina has graciously offered to be the proxy so that we have to send an email. And normally it would go to your personal email. You would have to go in and sign up somewhere. But it does allow us to have Katrina do it for you with the information we already have. So we won't be having to ask you to go into another system and set up. So it won't change how your payment comes or how you see your payment. I just want to let you know that we were doing that.
I can ignore that email that I got.
You certainly can. It wasn't a spoof. It wasn't a
Fish.
spoof. It did, didn't it? Yeah, so we want to avoid all that, so. We can take care of all the information that it needs with what we already have, so,
Thanks.
absolutely.
Thank you. Moving on to contract services and grant applications. Michelle or Don?
We don't have any.
You do.
And for break.
I could talk more. Take care.
We're good. Move on. We're gonna get out of here early today.
Now you.
Yeah.
Wait a while till the fog dissipates. Driving back.
Is,
I just reached out to see if our clinic manager, Rick Stimson, is available. He joined early. May.
I can go
you can do this.
track him down.
Are you teamsing Jennifer back?
Oh, here he comes. He's so good there.
Wow. You must have been listening.
We're an hour ahead.
You're a wonderful man.
Thanks for joining, or, thanks for allowing me to join your party. That's where I should stand?
Yeah.
Sounds good. Well, thank you for letting me join you. My name is Rick Stimson. I'm, the clinical manager in the Division of Family and Clinic Services, and our oral health program. So, I don't know how we advance slides, so I just,
Say next slide.
next slide, please. The things that we'll go over today real quick. First of all, did you watch the vignette already, or is that the end?
However you want to do that. Just
Well,
live.
Colton.
if it's up to me, Colton, can we watch it now? I think that would be a good introduction. You know, what we do, so when I present data, you have a good understanding of who we are and what we're doing.
The Oral Health Program at Southwest District Health is a community-based, goal-based dental clinic. We're able to collaborate with our WIC program, our immunization program, and serve children and families who are underserved or do not have resources and provide dental oral health preventative clinics. We provide dental sealant clinics, and we provide dental screenings to kindergartners and fluoride varnish. We provide permission forms so the parents and the families that want to participate may.
The oral health program is important for our students because some people can't afford insurance or can't afford regular dental visits, and is offered at no charge to the families.
We go into the schools and do our work.
And we actually see dozens of schools. We do see probably roughly around 2,000 students.
It's quick and they're with their classmates, and so it's not scary. They're not going into a dentist office and the long wait and all this build up. So it alleviates a lot of stress and anxiety that could happen.
What we have noticed is our provider list is shrinking. This year, when we updated our referral list, we lost 3 dentists who are no longer accepting Medicaid, and the ones that do are no longer accepting new patients. a lot of children usually don't say anything until something hurts, and we can catch something. If an area looks like it may be the start of tooth decay, we can catch it before that child needs a root canal. So it's early preventative care, and it saves our families funding that they may have to allocate towards basic living expenses.
I love that this is available for my own kids in the school. They love it, they get excited about it, and it saves me a trip to the dentist with them and taking off time from work. They're great to work with.
That kind of sums up a lot of what we do, and that's who we are. I'll kind of go over some of that again at the end of the PowerPoint. And by the way, if you have a question or comment, just let me know. We'll get right to you, okay? We're going to go over some data, some trends in Idaho, Southwest District Health programs, and who we try to reach with our programs. So next slide, please. The Idaho Oral Health Alliance did a survey. They regularly do a survey, and one of the things they asked recently was, do you know anyone in your area that is having, excuse me, difficulties in accessing oral health services? And 65% of people that responded to this survey, so said that yeah, they did know, and the top 4 reasons were they didn't have insurance, it's kind of a rural place, it's hard to get transportation, there's financial barriers. And of course, limited insurance, meaning they have, their provider doesn't take Medicaid or has a cap on the number of Medicaid patients they take. Which kind of sets the stage for the next slide, where we talk about our whole county, or all of our counties, are dental professional shortage area, meaning with the providers that we have, we don't have enough coverage to meet all the oral health care needs of the people in our counties. And that could be, in some areas, it could mean there's just not enough dentists or hygienists. And in some areas, it could mean maybe we have enough dentists per se, but they're not accepting types of insurance. So there's still a portion of the population that has to go without oral health care or access to oral health care. The next slide talks about non-traumatic oral health visits. Over the last 3 years, roughly 24,000 people in Idaho went to the emergency room because of a non-traumatic, non-hit in the face. Basically, their tooth hurts so bad that they went to the emergency room. And I share this just to kind of give you a demographic of who those are. So roughly, same male, female, but right as you become an adult, that's when you most likely to visit the emergency room, that 18 to 44 range. So just giving that information. So the next slide. I also think this is interesting and really telling too. Where it's that young, you wouldn't necessarily think that 18 to 44-year-olds are the people going to the emergency room for tooth pain, but it starts younger than that, where regularly the Department of Health and Welfare does a survey called the SMILE survey, where, and we participate in gathering some of that data. But the survey is of the 3rd graders that they see, how many have had experience with a carie or a cavity. So they either have a cavity or they have a feeling list, so they have been to the dentist. And as a health district, we're actually leading the way. We're doing pretty good compared to the rest of the state. 50% of our 3rd graders have experience with a cavity, which seems too high. If you go to the next slide. Too close here. Yeah, so 63% of Idaho 3rd graders have experience with a carie or cavity, which is just a little behind the national benchmark of 42%. Some of their stats I thought were interesting is dental caries or cavities are the most prevalent chronic disease in children today, more prevalent combined than the next couple. Granted, our young kids don't have a lot of chronic diseases. There's not cancer, diabetes, but combined, it's the most prevalent chronic disease. In the most recent survey, they found that 11.1% of third graders had active decay with no history of dental care. So, and that rate is a little bit lower than previous surveys, trending in a good direction. Next slide, please. So you already met them, but I wanted to reintroduce Virginia and Mary, our oral health team here. Virginia is a dietitian, hygienist, excuse me. She's a hygienist, and then her assistant is Mary. They go out to schools 2 days a week, and then they're here in-house, serving patients here in-house, and we're mostly just doing paperwork, catching up and getting ready to go out to more schools. Virginia has been employed at Southwest District Health for 19 years. So she is a great community partner. She knows everybody in those schools that she works with. If we go to the next slide, their mission, when I asked them, well, what's the purpose of this program? What do you guys want to do? This is their response. To improve oral health outcomes for children and families in our communities through prevention, education, and connection to care. So we go out, we do, the next couple of slides have pictures of, or even these, of her, checking in the mouths or giving fluoride varnish. She also does presentations to schools. She reaches out to parents. She teaches people how to brush their teeth, floss their teeth. And then when she finds something that's concerning, she connects that family to a local dentist. And since she's been around, she has a lot of connections to a lot of our great community partners who maybe they have capped their Medicaid population, but with a referral from her, they will see that patient. So it's really great to get those kids who need the most care connected to a dentist. So next slide, please. So our community partners include local schools, Delta Dental, the Oral Health Alliance, Department of Health and Welfare, and local dentists. They're all great partners. We have a great program. Delta Dental goes to, they've given us, you'll see in a couple slides, like an oral health exam chair. They bought us fluoride before. Most recently, they bought, I'm not wearing that picture, but the little glasses with lights on them so she can see. And we don't duplicate services with Delta Dental because they also go into schools and do very similar things. So if they can go into a school, then we don't go to that school. If we go into a school, we just kind of trade back and forth. Next slide, please. So these are the services we provide and a little bit about what they are. So first we do a screening. So, and I should preface that when we go into a school, we work with the school nurse and the school administrators. We send out permission forms. We say, hey, this is what we're going to do. It's available if you want them. We see kindergartners through third grade at the school level. Hey, if you would like us to do this, fill out the permission form and we'll do it. Otherwise, we're unable to see your child. We do a screening. If they want to opt into fluoride varnish, we'll do that. We do the oral health education. I think on the next slide, there's a couple pictures of her presenting in front of schools. I already talked about the next couple. And this is why it's important here. Prevention, pound of prevention is with a pound of, I can't even remember that.
Sure. Prevention is worth a pound of cure.
Yeah, that's what I said, right? You heard me? So we want to just prevent more serious problems from going. So it's on a personal standpoint. I have a kid who knocked his front teeth out when he was 3. And he is 5 now, and he struggles with speech more than me. I know I'm stuttering here, but he stutters more than I do. And it's just really hard to understand. And that's such a disadvantage for a child going into school. And mine was my son's was due to a traumatic event, but others can lose teeth due to decay, even at that early age. So we want them to be ready for school. We want them to be present at school, ready to learn. Hard to pay attention if you have a toothache or something. It's just promotes positive, healthy habits in the future and reduces those health disparities. So that's the why. Next slide, please. I want to talk about, oh, by the way, that's Mike Farrell kid right there. He dressed himself. And he's on one of the chairs that was provided to us by Delta Dental last year. So anyways, that's my little plug for my own kid there. But this is the reach. So we reach just over 2,000 people every year, which is pretty good considering we're only here or out in the community 2 days a week. So we're busy. Even today, Virginia and Mary are at 3 different schools. So they bounce and they do a great job. Next slide has a little bit more information on it. I thought it'd be helpful to show you kind of where our specific program reaches. Just to be transparent, like we're not a lot up in Adams County, mostly in Canyon County, but we are in a couple of schools in all the other counties. And the reason for that, I think I talked about before, is Delta Dental, their focus is more rural. So we don't go to the places that they go to. So they have partnerships in Adams County with the schools there. We're not there as much, although we could, if they want to trade us a school or go out or ask us to go out there, we'd be happy to do that. Just a breakdown of who we see or who opts in to see us, I should say. About 43% of our patients that we see are on Medicaid, and 35% don't have any insurance at all. And 1 in 5 have insurance. And I put this down as a placeholder because I didn't have the exact numbers, but we also go into preschool, which Delta Dental does not. So we do go to some of the schools that they go to, but we go and help with their preschoolers or Head Start or migrant Head Starts. And I think it translates to about 46 schools, 5 Head Starts, and 2 migrant Head Starts. So we get busy. And we do a lot of the preschools and Head Starts. That's kind of what we do during the summer as we recalibrate. So next slide, please. Just we'll get some funding through a grant through a sub-grant through the state of Idaho, the funding thing. And then I don't think there's another slide, but you could check. Oh, yeah, the resources or references. So I'll just open it up to now to you all. If you have any questions for me about our program, I'd love to share with you. Yeah.
So it's purely voluntary, though. You send a note out saying we're going to be in the school, and
Yep.
the parents have to opt in and provide that permission.
That's correct. So there are some moving parts. We suspect that some classes that have high, we do have some rates, some classes where we suspect the permission slip doesn't go out. So we'll have a 0 opt-in in one class and heavy in another. But we schedule those out at the beginning of the year. In fact, we already have next year scheduled. So if the permission slips don't go out, then we can't see those patients, even if they wanted those services. But you're right, absolutely. We only serve those who opt in and give us permission to do so. And then they can opt out of some things, like if they don't want the fluoride bars, right. Just this screen, do that.
There's pretty good participation in the population that you kind of estimate could benefit from it. You know what I mean?
We could see more, but over the last, I think there is pretty good participation, right? I asked Virginia, it kind of depends on school to school. She's been doing it for 19 years, so she has the connection with schools, as people are coming in and out. They'll make phone calls and say, remember, they'll personally go deliver the paperwork, and then they'll go and they'll kind of on their way past, they'll say, hey, remember, we're doing this, and then they'll pick up the paperwork in advance, and then people still kind of have another week. So she touches a couple of times to get that paperwork, but her estimation is about 40% of people return a slip. So So they might say no, but 40% of people bring back the slip, which I know is pretty hard anyway. That's pretty good numbers for a kindergartner through third grade to get a permission slip and get it back.
Yeah.
So there's a lot that stay in the backpack, but.
Yes.
You know, with the fluoride, there's a growing body of evidence, you know, linking fluoride to decreasing IQs in children. Is that something that has been reevaluated more recently to look at the risk benefit kind of analysis with you guys, or is that done at a different level?
For us, it's not done at our level, but we do work with bigger organizations and our supervising dentists to figure out what services are appropriate. And I know that some schools we don't even go to because of the natural fluoride levels in their area. So we do strategically look at GIS data. We work with Delta Dental, and of course we trust the evidence of other governing bodies that are doing research like you suggest. Thank you for your time. Appreciate you guys.
Thank you very much.
Thank you.
Yeah.
Oh. That was the big one, getting our dates set for next year. So everyone has a copy of the calendar here. This will be on in April, so we need to discuss, and Nikki will present what month we have issues with.
The one that I'm most aware of is January, right out of the gate. Because the week that it's currently scheduled in is IAC's annual midwinter conference. So there will be conflicts there. If we went the Tuesday before that, Martin Luther King Day is the 19th. And I know many of the boards and county commissioners on those holidays then meet on Tuesday. In the past, we have met on a Thursday. And in January, I'm wondering if that might be a better option for board members to consider. Well, it'll probably be the 22nd because Idaho Association Counties is still meeting on the 29th, I think, right? It's like pretty much the whole week. Maybe earlier than that makes it hard for us to get everything that we need prepared for the board. So, and I anticipate probably January and February being fairly lengthy meetings since we're not meeting in December and we have some budget stuff that we need board review on and action on. So, but don't really want to miss January. I'd like your input on what thing might work best.
Sure, we meet on Thursday for IAC. That's only Monday, Tuesday, Wednesday for most of us.
I feel like the special, there's
like IT.
breakouts. Yeah. Yeah, but I don't know. I don't know about the commissioners.
Second first for me.
AAC website does have it marked the 26th to the 29th. I have not seen it. I don't see it.
Last is.
Usually not commissioners. We could do the 22nd or 29th.
If we had to choose between the two, I'd rather do it on the 22nd, just because that's a long week at IAC. Yeah, I could turn around and have a meeting here.
True.
So if we have
Want you
that
at your
choice.
best.
What's that?
So we want you at your best.
Yeah.
22nd would work.
For the 22nd.
I can hear.
Sure, both
He's available.
you know.
Sure.
We have that's far enough.
I have
notice.
9 minutes too.
Well, I will be going to the week. That's the earlier in the week, so. Weed.
Like noxious.
Not.
No, it's good. I knew what he meant, but
I
Well,
will.
he was
I
talking
like
about
that
Burning
you were
Man
just-
earlier.
Burning Man, Huntington.
No, I'm a professional athlete.
Pain's really getting.
County athlete superintendent.
It makes more sense.
Free of charge. But anyway, I'm open any day, so whatever you guys decide.
22nd sounds good.
We'll do the 27th. Oh, one that I'm aware of that stands out. Katrina, were there any others?
No, January, sometimes we encounter a conflict with in September due to IAC scheduling. That date has not yet been released, and so if a conflict pops up, I will bring it back to the board to take a peek at, and we will find another date.
Second. So it would be IAC's week.
Do you want to do it now, or do you want to?
No, we can just wait till they schedule, but
Okay.
we make it now and then they have it on the 14th.
Yeah, there's 5 Tuesdays in September.
Yeah.
That one change to the 22nd, then, as an action item, so we'll need the board to approve it.
Yeah, September.
We're not sure because IAC hasn't set their date yet for them in a conference. So we will change it if we need to later.
I would move that we approve the calendar with the change to January 22nd.
Second.
Okay, it's been moved and seconded that we approve the board's South Pacific Health calendar for January to the 2026 to the 22nd. Any discussion? Hearing none, all those in favor? Aye. Motion carries. Thank you. Okay, Nikki.
Okay, next item on the agenda is our draft, work plan for the board for next year. So right at this point, we haven't, open to input now or, individually later, we haven't really outlined any special presentations. So usually that's like board education, like what I just presented to the board. We do anticipate Clearwater presenting in the first few months that they finish up their assessments. So we have them kind of penciled in January and then I think maybe in March. And then the tobacco and vape use prevention for youth, we were gonna have staff present on that in December, since we're not meeting in. And the standing agenda items that you see kind of in the middle column are pretty much the same as they were the previous year, just updated dates. It's just the general business that we go through, with, depending on the time of year, the beginning of the year's budget, development. So we have, things that we would have done in December and January, and then, so that's why January looks long. And like I was saying, we might have to have some extended meetings in the January, February, March timeframe to get through, the budget development pieces. So, aside from that, nothing, is really different. And this is more for guidance. I don't need the board to take action on it, but I wanted to make you aware and give you the opportunity to provide input if there's anything that you would like to see in particular, in the coming calendar year.
ICS training.
That, was Ricky and laid about last month and the year before they did the trained incident command system
Oh,
training. We could keep that on or take that off. We've done that as a work session. Well, the first year we did it as a work session this year or last month. It was a one-week vacation.
you remind me what the Clearwater, was that the
That's the,
brand?
the third
You
party
would-
assessor.
yeah.
Assessment.
Okay.
It'll be since in January, and I think they'll be done maybe March or April.
Any discussion on this?
So this leaves room for special presentations like the dental program and
Yeah, I just haven't built them in yet because I was hoping to meet with board members, kind of get input, talk to our leadership team. Our internal conversations, we've talked a little bit about focusing on some of the behavioral health work that we're doing or planning to do coming, in the next year or so. And kind of getting into the details about that a little bit. Last month, you might remember Michelle presented on a change of how we spend opioid our opioid funding and asked the board to approve that, which you did, but there were some questions around like what we're doing. Kind of, we thought after listening to what you had to say that there might be some value of having a little aware of the services that we're providing and what we're doing and what we're relying on partners to do. Aside from that, do we have a question? That's much.
Further questions? Anything on that? We review and approve the 2026 district health position statements.
I guess I don't know what year this is, but we haven't been doing this too long. I think maybe the third year. We started off, I think, 3 years ago with like a 65-page document. We're down to 7. So we're getting this refined. But as you might recall, I have found it helpful to have some conversations prior to the upcoming legislative session with the board around what our positions might be as a district on various legislations. And it helps me and I think board members also kind of know if they're being asked questions from legislators about the position of the district on something, where we stand as a district. So these aren't super specific because we don't know exactly what will be introduced, but aside from, I'm guessing we might see something on food fees. But the other, starting on page 4, these are more general, and a lot of them are kind of this foundational public health prevention type positions. There are a few that when we have an idea that something might be coming that we are addressing, and I'm happy to highlight some of those. You'll notice there's a few that are in bold. So what we did this year is we cut out some that were just kind of redundant or we didn't feel like were important at this point. So we removed those. The ones that are not bolded are pretty much carryover from last year. So the board approved them last year. We might have changed some wording a little bit. And then the bold ones are new. A couple that I want to point out at the bottom of page 4 is a position statement about supporting funding for home visiting programs. And we had home visiting in here before, more just like from a programmatics perspective, but we added the funding piece this year because there's several things happening around home visiting funding in the state that isn't, it kind of puts that at threat. So we are, advocating for that funding to continue because we see the benefit of those services in our community. And then on page 5, we have two new ones. I'll just highlight the ones that are bold here. the district supports Medicaid coverage for lower cost mental health service interventions that can contribute directly to reduction in law enforcement and justice system involvement. With some of the changes and reductions that Medicaid's recently made, they've cut funding to some services that really help that kind of recidivism and interaction that you see with law enforcement. I feel like it's not only is it better for the patient and public health, but also I think the counties benefit by not having that revolving door. People have that mental health support. So that's something that we thought was important to include.
Mr. Chairman,
Yes.
is this, how does this get affected if they go through what they're talking about in repealing Medicaid expansion?
I think it'll just make it worse in terms of like, there's already been a reduction in compensation to providers. So we're seeing some providers take less Medicaid. Some services are not being covered, more prevention focused. So it's going to result in people not getting the prevention care, which if they don't get that, then likely they need more higher need care later. And then if Medicaid expansion goes away, fewer people will be covered. I don't know if you have anything to add that I might have missed.
I think too with the federal changes, so just to be on Medicaid, in the next year, they'll have instead of annual redetermination quarterly, then there'll be more requirements for, either, work or volunteerism. So I think it'll become harder for people to stay on. So whatever those impacts may be. And I think too, we're gonna see in the next 2 years, more cuts to Medicaid reimbursement to providers, so.
I was gonna ask Rick, but is that partly why we lost the 3 dentist providers?
Oh, yeah, that except Medicaid, yes.
Yeah. Okay.
They're just like, we're on Medicaid, it's like other commercial payers, that, yeah.
And then further down on page 5, we added the district supports investments that expand availability and access to health education that fosters well-being and improves mental health for Idahoans. It's fairly vague, but intentional. Some of the work that we're looking at, investing some more resources in the coming year and beyond is around like helping children and parents and the elderly, like with social media and navigating, I don't want to say responsible use, but well-informed use maybe might be better to try and mitigate some of those consequences that we see. So that's just like one example, but we've talked about internally about other health education around nutrition, for example. I would anticipate at some point RFK Jr. redirecting some funding priorities towards nutrition. And I think that's really, we have dietitians, you met one today. I think we could really leverage the knowledge and education and expertise that we have in the district to really lean in on the education side of that with our community. So that's kind of why that's there to, if ABAC has the opportunity to approve funding from that's coming to the state, we would like them to do that so that those funds could be passed on to the districts potentially. Page 6. There's one new one on here. The district supports maintaining Idaho's reportable disease requirements and adopting updates recommended by the Department of Health and Welfare to ensure timely monitoring of critical conditions, such as infectious diseases, cancers, and what's like rabies. I think you're all familiar that Idaho has, I want to say it's like over 70 diseases and conditions that are considered reportable by physicians and labs, schools. That those rules are up for review by the legislature this year. And then they've also been moving a lot of rules into statute. So that this is one that we would like to see continued when you might have a question around what updates the Department of Health and Welfare might have. The only one that they've shared with us that is that they're considering asking the legislature to approve is the blood lead levels for children threshold for reporting at the national level has changed, and so they want to align with like the federal standard out by the CDC. But aside from that, it would just be adopting it.
Is there any talk of eliminating the requirements?
I don't think so, but I think there's just been questions about it. And so not to my knowledge. But I think, you know, it's work that I feel our community looks to us to provide data and information around disease trends. So I think we would like to continue to have that be supported so that we can provide information when asked for it. Page 7, we have one new one here. That the district supports improving access to child care without compromising health and safety, and then also reinstating ICCP income qualifications to pre-2025 levels. It's kind of a two-part position statement. And the reason that we added this is last year, you might recall, the legislature loosened childcare standards for providers. And I think their intent was to try and make it more accessible to people, or to like increase capacity in childcares. It's a, I don't know, conundrum kind of. We know that there's a access issue for childcare, not enough childcare providers to support what's needed. And at the same time, you want to ensure that they're safe when they're in the care of other providers. Having had some bad experiences, well, I think you might remember, we just had a presentation on that a couple months ago, I think by one of our staff. So, so we would like to see them work on improving access, but also not compromising health and safety. So that's one aspect. The other is, and I'm not sure what the driver of this is, and I don't know if Ben has more information, but in prior to this legislative this year, the ICCP is but it's kind of like a support for low-income families to help offset childcare costs. And they reduced that pretty significantly so that it made it harder for low-income families to be able to get paid care.
ICCP, that Idaho Child Care Providers Program.
Yeah.
So how does that work?
I don't know that I can speak to it. The childcare in Idaho is like, there's kind of like 3 different entities that are involved, and it's a little bit challenging.
So you do a comment about what we just went over as far as the work plan for the year. I kind of think it would be helpful to go over, if we're gonna have these as policies and position statements, maybe go over one or something each meeting. That way the board
A little bit more.
reminded of what we are supporting. And then we can choose maybe after the presentation and materials and whatnot, if we're gonna keep doing that or not. You know, what's updated.
What do you think?
It's just like that, like I have the same question. I was trying to figure out the acronym and then, well, I have no idea how this works because I've made my wife stay at home, so I haven't had that childcare, so. And I say that every day. I mean, I'm just thinking.
Like, let's say that was a mutual decision.
I saw Katrina. Like, well, what's this?
I know of families that, the cost of childcare, they've quit working on Medicaid at the SNAP. Can't afford to pay childcare, so they can't afford to go. Just offset the childcare for them to actually survive. It becomes a conundrum because you want people to go to work and not be on the time. Childcare is so expensive. It kind of reduces their ability to viable family. So families that have done that, I disagree with that. For them to survive financially, that was a choice. Something to think about. That's what is out there, especially single parent. Very much. We're able to get some kind of a family member that's touched the children. They find some other program that childcare. Not going. Depends how much childcare you go to. There's so I would choose to shut the doors on them. But, it just takes more. It's away from being able to go to childcare. Just something to think about. Or there are try to do one thing on this side, of creating a bigger problem on the other. Think about it.
On the other hand, if you highly subsidize the childcare so that people can go back to work, they're still on the dime,
Yeah,
but they're not there with their kids, so.
It becomes,
Downside.
it's a real conundrum. I don't know, what is the right answer? It's a,
I think first safety, right? Like,
yeah, absolutely.
overriding priority.
I know one, it was in the Homedale area. They operated for many, many years until finally somebody was smart enough to say, we got a problem here. And they ended up that they got shut down. But I mean, there was a lot of kids that it was because there was nowhere for, there was a lot of turnover there with kids because the parents would say, this is not what my children should be in. So they would go out, but with the lack of childcare, somebody else would just immediately go in there and then they would see the problem. So eventually they had to shut it down, but it's still these children are not in a good place for a period of time. They shouldn't be. The place should never have been opened. And what they do now is they just cut their numbers down so they're underneath that requirement. So it's just I use for time with it.
Another comment, reference to what you said, I just did that survey finally. I don't know if everybody else did, but I was thinking, the priorities that rise to the top in the survey, including those on the agenda. For example, with BMS, community paramedics. I'd like to learn a little bit more about how that works, if that's something maybe we can replicate. So, sort of thing.
One other thing, position statement that I think would be good for us to add to this, discuss would be, one of the federal issues right now under vaccine safety data. It's kind of a bigger talking point and things that the federal regulatory boards are looking at. So I think something along the lines of, we support active and transparent access to vaccine safety data. Be wise and line of things.
Can you say that again so I can get the wording right? Accurate.
We support open and transparent vaccine safety data.
I think you said active,
Yeah.
There too, and then I'm like, I must have heard that one.
Open.
Open and transparent.
Yeah.
You gotta go get the vaccine to begin with.
Well, it's been an issue with accessing some of the state data, regulated vaccines, and so there's been some legislative look at how we can make that accessible. We should support, having open accessible data that doesn't compromise patients. privacy.
Should always be open and transparent. Everything should be open and transparent. Be more on the position statements. Okay.
Hold on, let me see it. I want to make sure. Okay, that's the last page. We have this as an action item. Yeah, the board wanted to, vote to support it with the addition of Dr. Fizzle.
Ask for a motion to approve the position statements with the addition of Dr. Fribbles. Wanting that, for the access of, open, free, and clear information on vaccines.
Sounds like a motion right there. That sounds like a motion.
Yeah.
I would second that.
It's been moved and seconded that we approve the position statement, as I just stated during further discussion. Hearing none, all those in favor? Aye. Thank you. Reference report, unless you want to stop.
Like a break.
Just get a few more minutes.
Let's do it. Commissioner Brooks might want to soft ones. You might want your chocolate almonds. You can do it. Actually, before I go into the director's report, I want to follow up on Commissioner Brooks, your comment about, covering the priorities in the work plan. So that would be like this year, if we were to incorporate these, it'd be kind of in the rear. Is that what you were thinking? Or are you thinking more forward planning in terms of, it's hard to maybe forecast out that, far, but I also don't want it to be.
I don't know. I don't think it has to be super in depth unless it's something that we haven't talked about for a while, but just kind of a refresher of how we got here in the first place to making it a position statement or a funding priority. And then if you've heard any scuttlebutt on like it changing at the state or the federal level, or even the local level, like how is it, we have all the other presentations too, reports of how it's going in the district or the community, so.
Additional context is
Yeah.
helpful. I just want
Yeah,
to
that's,
make sure we were on the same page.
You had mentioned work plan. My understanding was Commissioner Brooks was referencing a position statements when he asked for.
He was asking.
I missed that. Thank you. Also, before we conclude, Michelle has some follow-up information on the questions that Commissioner Brooks had.
Yes, Mr. Chairman, the numbers that are on your revenue and expenditures for the first page under the fund balances are accurate. The total is not. So the numbers that are there, the 1.3 million, the 5.6 million, 113,000 and the 1.2 million should add up to 8,418,931.
Is the September 2025 ending? That's accurate.
That's
That's number
accurate.
three.
Yeah.
Okay. On to director. Wanted to follow up with those especially who weren't at the annual Idaho Association District Boards of Health meeting. There was some discussion at the time around the executive council meetings. And as a reminder, Commissioner Purdy sits on it represents our district on the executive council. And they meet most frequently around the legislative session. I think they'll have weekly meetings on their calendar, although they probably won't meet every week if there's not any. And there was a suggestion that other board members be invited to be able to sit in and listen. And so I did forward you those invites. So I just wanted to follow up and let you know that Although Commissioner Reed just gave me a funny look, so maybe I said I was going to and I didn't, I don't, but I will. And you're welcome to attend and listen in. We actually have one scheduled this afternoon. Mr. Penny is uncertain if she'll be able to join. Although Commissioner Humsbury said he'll plan to listen in. And just for your awareness, I know they're meeting this today and then maybe one more time before the legislative session. And today they're going to be talking with Kelly Brassfield from the Association of Counties. See what priorities are for the counties, and then also talk about food fees. And then Mike Kane, who's our legal counsel, he also lobbies for us and other health districts periodically. He's also going to join our conversations as informally with Kelly. It sounded like food fees are a priority for the Idaho Association of Counties, but they weren't sure like how much energy is going to be put there versus some of the other unfunded mandate priorities. It sounds like it's
It was kind of a weird meeting this year where we didn't have like 5 distinct topics that we picked as the priority. There were, what, 2 or 3 kind of groupings of very similar topics, and they all just kind of jived together. And then, so I don't know, it's probably 8 or 9 different topics, but they're jammed into 5.
Yeah.
So we'll see how it goes.
yeah, that kind of sounds consistent with what Kelly gave me in like a 2-sentence summary. So we thought it'd be helpful for the executive council to talk about how much we want to, as public health districts, provide support to kind of move that forward this year. And join us too.
Can you forward me? I didn't get that.
Yeah, I'll forward it to you. Yeah, and I think there's maybe 2 or 3 invites because there's, I think, one for this meeting, maybe one in December, and then like a reoccurring one for next year with the session. So you'll see more than one. I'll just forward them. Board of Health Strategic Planning Survey, I emailed that out to you. Commissioner Reeve just mentioned it. I also have hard copies here. I'd really love it if you would do it before you leave if you haven't done it. And I think I indicated in my email, but my plan was to help this inform the strategic planning and budget planning meeting I have with Commissioner Abster and Commissioner Brooks, Commissioner Reeve on Friday. I've had our leadership staff and middle managers do a similar version of this, so we'll have some internal input and just some board input too. And that'll help us as we get ready to do our budget development and really making sure we're putting our limited resources to good process. Pass these around. It's not that super easy to read because it's be online, and there is a ranking thing on there. You're not gonna be able to like obviously use things to rank them, but if you just want to number them or cross out things you don't like, that's fine. Or write in. There's like a little space to write into.
It's not hard to do it on your phone.
Okay. Yeah, I know he had tried to do it on his phone, and but I'm not sure what you want. Yeah. So we have that, and then just my standing item, which I won't present, but it's in your packet of the grants, contracts, sub-grants, things that have been signed since the last meeting.
Can you talk about these?
I haven't been presenting those. I just have been including the information. But if you have questions, I can.
By today.
I started. It's due today or Friday?
Friday.
You said you want it by the time you
I'd
leave.
like it before you leave today.
You have extra time, you
But
can have snacks, you can do it.
You've got like almost 2 hours.
You could probably go and borrow the computer.
You could.
Why would I take the dartboard out? Put 'em up there. Did so well, I started on it too.
Yeah.
We did that too and then lost all of it. They forced me to go back and think about it all over again, so.
I answer your question about that?
If we like Rick. I'll get the information. How many Delta Dental does in our. So we have the numbers for what we do, children. Health. And the Delta Dental do. For health. The actual children going for for healthcare.
You want to know the number of schools or the number of patients or both?
Another 2,200 with district health is 22, 25, 3,000.
I'll see if we can get that from them.
And that'll be in, because our future agenda be in January. That right now is the 22nd, so. Was there any other agenda items? Anyone else? Okay, and hearing none. You don't think there. This was still a record.
We're gonna finish off the year.
Oh, my word.